Hello everybody, my name is Dr. Anil Kamath. I am a senior consultant surgical oncologist at Apollo Hospital, Bangalore. What happens after a person is confirmed to have prostate cancer? Now the next step would be to stage the disease, that is to see what is the extent of spread of the disease, whether the disease is confined to the prostate, whether it has spread in and around the prostate, or whether it has spread far off to other organs and areas. Now, there are various factors to be considered before initiating the treatment. The most important things would be the age of the patient and how long he is otherwise expected to survive. What are the comorbidities that he has, like a heart problem or a lung problem. The third thing would be to see the aggressiveness of the tumor. Is it a less aggressive cancer or is it a more aggressive cancer? And what are the symptoms that the cancer is producing? All these factors have to be considered before initiating the treatment. With regarding to the treatment, one should remember that in prostate cancer, not doing anything or wait and watch is also considered a type of treatment. Suppose we have an elderly patient with a less aggressive prostate cancer, then nothing needs to be done for these patients in some cases. This is because not all prostate cancers are aggressive, and sometimes the patient, it may not give the patient problems for the rest of his life. In other patients, we have to stage the disease. There are stages from 1 to 4 and treatment is given based on the stage. In stage 1 is when the cancer is detected very early and affecting only a small portion of the prostate. In these cases, the treatment options would be either surgery or radiation. In surgery, the surgery performed is usually called a radical prostatectomy, in which the entire prostate gland is removed and the bladder is anastomosed to the urethra. Now this surgery is performed in various ways. Like traditionally it was done by the open method. Now there are less invasive methods like the laparoscopic method, and even robotic prostatectomy is being practiced in a lot of places. The next treatment option is radiation. Now radiation is given in two ways. The prostate is marked out based on imaging finding like CT scan or MRI, and radiation is delivered to that area. Radiation is of two types. One is teletherapy, in which the radiation is given from outside, and brachytherapy, in which implants or wires or beads are placed inside the prostate and radiation is given in a higher dose to that area. Now in stages 2 and 3, the role of surgery is lesser and the role of radiation is much more. Now for stage 4 or metastatic prostate cancer, quite a few patients are detected in this stage. The main treatment would be what we call hormone therapy. Now the development of prostate cancer is mainly related to the male hormones or androgens. These hormones are produced by the testes in males. Now depriving the prostate of this hormone automatically leads to shrinking of the prostate and control of the tumor. Now one of the effective ways of treating metastatic prostate cancer is by depriving these hormones by removal of both the testes. Now here the testis is removed, though it is not the main source of disease. It is removed because it is the source of the hormone androgen, which is responsible for development and spread of prostate cancer. Now for those patients who don't desire to have the testis removed, there are other options like injections, which are called luteinizing hormone releasing hormone factors, in which the injection given has an effect similar to removal of the testis, but once the injection is stopped, the androgens can start getting produced again. Then there are tablets which block the androgen hormone. So these are various ways in which metastatic prostate cancer is treated. For those cancers which have come back after initial treatment, nowadays there is option of giving injections or chemotherapy as well. And besides this, there are newer treatment options like biological therapies which are coming up in recent research. Prostate cancer is one of the curable cancers, and even if it can't be cured, it can be definitely controlled in quite a few cases. So treatment, especially in early stages, is highly effective and highly rewarding, and the chances of cure for the patient are quite high. Even in advanced cases, just by initiation of hormone therapy, which does not have as many complications as most of the other treatment, the disease can be kept under control for long periods of time. So it is a cancer which can be detected early, can be effectively treated, and has effective treatments available for it. With regarding to the treatment, one should remember that in prostate cancer, not doing anything or wait and watch is also considered a type of treatment. Suppose we have an elderly patient with a less aggressive prostate cancer, then nothing needs to be done for these patients in some cases. This is because not all prostate cancers are aggressive, and sometimes the patient, it may not give the patient problems for the rest of his life.